Good afternoon, everybody. This is Dr. Agrawal. I am a board certified family physician in state of Oregon. This is my YouTube channel where I talk about common medical ailments that we see in primary care practice. And I am trying to just educate and inform everybody about these problems. I'll start with from A to Z. We have talked about A, B, C, and now we are on D. This is no consultation video, just an informational video. So today I'm going to talk about diarrhea, actually acute diarrhea. So diarrhea is, there are a few definitions of diarrhea. The most common ones are loose stools, loose watery stools, or increased frequency in stools. And acute diarrhea disease accounts for about 179 million outpatient visits annually in the United States. It's so much, it's such a common problem. And diarrhea is divided into, various categories. One is inflammatory, other one is non-inflammatory. And both types, they can be infectious or non-infectious causes. The infectious non-inflammatory diarrhea is often viral. The cause is viral. For example, if you're on a cruise ship or you're in a party, and those kind of viruses, they grow very well in these kind of situations. And if one person gets sick, the other one will fall sick as well because of eating the same kind of food. And it's a most common presentation in primary care. However, bacteria can also cause diarrhea, and those bacterial causes can be related to travel or foodborne illnesses like dysentery. Now, history of for patients with acute diarrhea should, mostly these patients, they come with onset and frequency. They come with, oh, I started this diarrhea a couple of days back. I was at a travel, and this is how it started, or I ate at a restaurant, and this is how it started. So the onset of the symptoms are shorter, and then I have been having, and the frequency is pretty, it's high. For example, the patients come and they say, oh, I have four stools in a day, or I have 5 stools in a day. And then also we look at stool character, whether it's watery, it's the color of the stool, if there's any blood in the stool, any mucus in the stool, and so forth. And then we also look at other systemic symptoms like fever, nausea, vomiting, abdominal pain, and so forth. So the first thing is, so again, I said that if you have diarrhea, if you have loose stools, then you need to make sure if you have any underlying or other systemic symptoms along with it, like if you have high fevers, abdominal pain, or nausea, vomiting, throwing up, you're not keeping anything down, or dehydration, you need to definitely contact your doctor, make sure you're not having any bacterial infection, because in those cases, you need an antibiotic. But if this is just diarrhea, a low-grade fever, a little bit of appetite loss, then it most likely is a virus. And in those cases, you can treat it at home. Definitely consult your doctor. Definitely call them, let them know, get their advice. But most likely it's a virus. Make sure you're well hydrated. Drink plenty of fluids, maybe like a Gatorade, 2 ounces every hour or so, or a Pedialyte, or you can dilute a Gatorade so that the sugar content is lesser. And then you can also start some probiotics that help build up good bacteria in your stomach. And you can also take some softer diet rather than regular diet. And soft diet includes chicken noodle soup, some jello, some broth, those kind of things. If you have, if you notice any blood or mucus, it means that there could be more to a viral infection, and that needs to be taken care of. Some diarrhea can continue for longer time, and those are like chronic diarrheas. And common causes of those can be inflammatory diarrheas, like ulcerative colitis or Crohn's disease. In these cases, patients are a little bit more sicker. They'll have some more abdominal pain of higher intensity. They can have underlying fever that can last for longer term. And then the other most common thing we see here in primary care is something called irritable bowel syndrome, where patients also have chronic diarrhea, and their history is very typical. They'll say they have to go to the bathroom immediately after eating. Again, always consult your doctor to get evaluated and rule out other underlying causes for diarrhea, but make sure that you take plenty of fluids, make sure you're well hydrated, take some softer diet, some probiotics, and then oral rehydration is preferred, replacing the water electrolytes and nutrients, those kind of things. Now, if you have children and they have diarrhea, then definitely consult their pediatrician, because these kind of sometimes the diarrhea can be harmful for children, and children are more prone to get dehydrated, and in those cases they might need to they might need hospitalization. Again, diarrhea is a common ailment we see. The most common causes are viral causes. If you have a history of travel, if you're noticing other systemic symptoms that are not getting better, like fevers and high fevers, vomiting, or mucus or blood, then you need to approach your doctor as soon as possible. If you have questions, please comment below. I will be happy to answer them. Take care. Bye-bye.